Hi, I'm Tara Schmidlin, one of the CPMC genetic counselors. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Breast cancer is a cancer that forms in the cells of the breast. There are a variety of types of breast cancers. The most common form is a cancer that starts in the milk ducts called ductal carcinoma. Both men and women can develop breast cancer, but it is far more common among women. Breast cancer is the most common cancer diagnosed among women of all races and ethnicities. It is estimated that 1 in 8 women in the United States will be diagnosed with breast cancer at some point in their lifetime. The breast cancer risk factors that the CPMC study reports on have only been studied in women. Therefore, men will not receive risk estimates for breast cancer. If you are male, your genetic variant result may be informative for your female relatives, your mother, your sisters, and your daughters. There are many factors that make up your overall risk for developing breast cancer, some of which you can control and some of which you cannot control. The primary risk factors for breast cancer include being female, increasing age, having a personal or family history of breast cancer, radiation therapy to the chest as a child or young adult, postmenopausal obesity, having your first menstrual period before the age of 12, beginning menopause after age 55, having no children or having your first child after age 35, having postmenopausal combined progesterone estrogen hormone therapy, alcohol consumption, breast density, and genetics. We mentioned that genetics are a risk factor for breast cancer. The majority of breast cancer cases are caused by a combination of multiple genes, lifestyle factors, and the environment. It is estimated that about 27% of the risk of breast cancer in the Caucasian population is due to differences in genetic risk factors, while the remaining 73% of the risk is due to differences in non-genetic risk factors. Rare genetic variants, like those in the BRCA1 and BRCA2 genes, can have a very large impact on the risk of breast cancer. These genetic variants only account for about 5 to 10% of all cases of breast cancer. The CPMC research study is not able to test for these rare genetic variants. The CPMC study only looks at common genetic variants that have a modest effect on your risk. You may be at risk of having a rare genetic variant if you have a family history of Ashkenazi Jewish ancestry, early onset breast cancer diagnosed before age 50, 2 or more family members with breast or ovarian cancer diagnosed at any age, and breast cancer diagnosed in a male relative. A CPMC genetic counselor can help determine if you should consider additional testing for a rare genetic variant associated with a high risk for breast cancer. CPMC genetic counselors can be reached via email at cpmcgc@coriel.org or by phone at 888-580-8028. While most breast changes don't turn out to be cancer, make an appointment to see your doctor if you find a lump or identify any of the following changes in your breast: a breast lump or thickening that feels different from surrounding tissue, bloody discharge from the nipple, changes in the size or shape of a breast, changes to the skin over the breast, such as dimpling, inverted nipple, peeling, scaling, or flaking of the nipple or breast skin, and redness or pitting of the skin over your breast, similar appearance to the skin of an orange. Talk to your doctor if you are experiencing any of these symptoms. It is not possible for breast cancer to be diagnosed by genetic testing. Breast cancer must be diagnosed by a physician using the following tools: breast exam, mammography, ultrasound, biopsy, or breast MRI. There are a variety of screening tests available that can detect breast cancer. The American Cancer Society recommends the following for women at average risk. Women aged 20 or older should perform monthly breast self-exams. Women in their 20s and 30s should have a clinical breast exam every 3 years, and mammography screening should begin at age 40 and should be done every year. Individuals who have a personal history of breast cancer, a personal history of radiation therapy to the chest before the age of 30, a family history of breast cancer diagnosed before age 50, 2 or more family members with breast or ovarian cancer diagnosed at any age, or any male relatives with breast cancer should talk to their doctor about screening more frequently. Although screening and self-exams cannot prevent the development of breast cancer, these methods may help detect breast cancer in an early and more treatable stage. In addition to breast cancer screening, changes in your everyday lifestyle can also help lower your risk. Consume alcohol in moderation, be sure to get regular exercise to help maintain a healthy weight, and limit the use of postmenopausal combined progesterone estrogen hormone therapies. Additional preventative measures such as medications or prophylactic surgeries may be an option for women at higher than average risk of breast cancer. Now let's talk specifically about the CPMC results and genetic risks for breast cancer. Studies have shown that a particular genetic variant called RS2981582 is associated with an increased risk for breast cancer in women who have 1 or 2 copies of this variant. This variant is relatively common in the general population. About 60% of the Caucasian population has at least 1 copy of this variant. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this risk variant you have. Your breast cancer results tell you about the impact of a risk variant on your risk to develop breast cancer. Having 1 or 2 copies of this risk variant increases your risk of breast cancer compared to women who have 2 copies of the non-risk genetic variant. Having 2 copies of a non-risk genetic variant means that your risk to develop breast cancer is lower compared to women who have 1 or 2 copies of the risk variant. Remember, breast cancer is a complex disease, which means that it is caused by a combination of variants in multiple genes and the environment. No single genetic variant causes breast cancer, so no single genetic variant will completely predict your risk for breast cancer. Rare variants exist that are associated with a high risk of breast cancer. The CPMC does not test for these rare variants. Results of CPMC testing alone do not diagnose breast cancer or rule out the chance of developing breast cancer in the future. Genetic variant information can help estimate your risk of breast cancer. However, other risk factors, like your family history or lifestyle, may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of breast cancer in the future. As we learn more, your estimated genetic risk for breast cancer may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.